Up to exam, actually, they are assessing your communication skill. You already pass your part one, where you show your knowledge. So to pass the exam, you need to be very best or your very best in communication skill. And it marks in three domains like data gathering or history taking, interpersonal skill, and management. Okay, clinical management. So if you talk about data gathering, it has to be very, very concise. If you spend too much time in data gathering, then you may be run out of time for management and clinical examination. So you have to be very focused. You have to exclude the patient's idea, concern, expectation. You have to exclude the red flag symptom, and you have to manage the diagnosis of the problem and manage accordingly. Otherwise, you will fail the exam. So you have to put same amount of time in each domain. If you spend too much time in data gathering or clinical management, then you won't be able to finish the case. Hello everyone. Part 2 exam is actually assessing your communication skill. They already check your clinical knowledge, that's why you pass the Part 1 exam. Okay, the exam assesses you in three domains, like data gathering or history taking, clinical management, and the interpersonal skill. Regarding data gathering, you have to be concise, you have to be very smart. Okay, you have to ask the question to the point, you have to have the precise history. Okay, otherwise you'll run out of time. The important thing in data gathering, to have the history and get the core of the case as soon as possible. Then you can elaborate and exclude the red flag symptom. You can address patient idea, concern, expectation. Otherwise, you won't be able to finish it on time. If you spend too much time in the data gathering, then you'll be struggle to finish the case. You don't have enough time, maybe you want enough time for clinical examination, for the clinical management, to explain the management to the patient. In regarding clinical management, you have to, as we discussed earlier on data gathering, you have to explain patient idea, concern, expectation, and you have to tell them what is the diagnosis and what's the reason. Okay, and you have to understand the patient checking, and has to be shared management. The patient need to agree with your management. The patient need to be on board with your management. So, for example, and you have to show or demonstrate your knowledge. If you say, for example, if someone come diagnose, if you have a case for 45-year-old gentleman came to see you, you found out the patient is diabetic, and you need to explain to the patient and explain to the management as well. So, for example, if you want to start him on some medication, you have to tell him what medication you're going to start him. If you say just, I'm going to start you on some anti-diabetic medication, it doesn't make sense. So you have to say, okay, I'm going to start with this medication called metformin. You have to take initially 1 tablet twice a day. So by saying this, you're demonstrating your knowledge, and the examiner will know that you know about the medication and you're giving the right dose and right treatment. That's the important thing. Other thing, you have to checking the understanding of the patient. You have to make sure they understand what you're saying and they are on board with the treatment. In regarding interpersonal skill, the important thing, you have to have a good rapport with the patient. You have to build a good rapport with the patient, good eye contact, and if you need to smile, you need to smile. But there's a myth like you have to smile with all patients. Patient may come with some, cancer diagnosis, and you are smiling at them. It doesn't look nice. Okay, so it goes with the case, varies case to case. So important thing is to build a rapport, good eye contact, active listening. You have to give time to the patient, enough time to the patient to explain their problem. So we say first minute is golden minute. So just open question like, how can I help you? What can I do for you? And then the patient will start talking. And then you start questioning. If they give you any verbal or non-verbal cues, you must explore it. It must be there is something behind this. Okay, otherwise you won't pass in interpersonal skill. This is important. Okay. Then other thing is like psychosocial side of the patient. Okay, so you need to know what's going on, how it's affecting them at work, how it's affecting them at home, how it's affecting them personally. This is the important thing. Is there any financial impact on them? Is there any psychological impact on them? This is the important thing you need to explore. And towards the end, when you summarize the whole case, you have to checking, as I said earlier, you have to keep the patient on board. Has to be patient-centered. It's not, the consultant has to be patient-centered, not doctor-centered. So, patient has to be happy with your explanation, with your clinical management. And then you will pass the exam in high color. Other aspect of the consultation is important thing is make sure you safety net the patient. Make sure you exclude the red flag. And if there any follow-up, you need to mention to the patient, we'll see you like 2 weeks time or 3 weeks time. Or you need to make an appointment with your GP in 2 weeks time to see how things are. If you talk about safety netting, if I give you a simple example like MI or angina, if someone come with angina to see you, stable angina, so you are giving the treatment like DTN spray, aspirin and stuff, and then you can tell them, if you do the examination, you do the ECG and everything, if there is no ECG changes and history goes with stable angina, then we need to refer the patient to rapid access chest pain clinic. In this case, when you send the patient home, you need to tell them, like for example, if you have central chest pain, which is quite crushing, severe chest pain, you feel like someone sitting on your chest, is the pain radiate to your arm, neck, you feel sick, you feel sweaty, clammy, then you must call 999. So this is the safety netting. Patient need to know if things get worse, how to seek help. Okay, and if we other thing, when you say red flag, we mentioned earlier red flag thing. Red flag is this is important to exclude red flag. So for example, if someone come with any tummy pain, 75-year-old gentleman with some changes in bowel habit. Okay, so when you see the age changing in bowel habit, tummy pain, first thing we'll think about cancer in this age group. So you have to exclude, like, is there any weight loss, how's their appetite, is there any blood with their food? This is the red flag symptom. And this is important. If you don't explore this, you will fail the exam or you won't have the good mark. Okay, I wish you all the best. When we talk about challenging cases, this is the area as the IMG we struggle. Especially when there is sexual health involvement, some ethical involvement. We really struggle to explore the agenda. We really struggle address the patient concern. So, for example, if you may have some cases like young male, recent travel history, went to Thailand or somewhere else. So those cases, and you need to, very, very important to explore the sexual history. They may come with some, for example, simple symptom like diarrhea. When you dig on history more and more, like obviously someone come with diarrhea, we ask, do you have any vomiting, any sign of infection, and then any temperature, any blood with the poo, any tummy pain, how's the appetite, any sign of, any history of having takeaway food and stuff. And another question in diarrhea we asked, have you been abroad? This is important. We say sometimes people have diarrhea, we say traveler diarrhea. It's very common when people go abroad to have diarrhea. When someone, young male, traveling to Thailand and those countries, you must explore about their sexual health. How do you ask this question? It's important. So if you feel shy, the rapport with your patient won't be good. So you can't feel comfortable to ask this question. So you have to be neutral in these cases. You have to ask, okay, but before you ask the question, you have to put some warning sign, like warning question, like, okay, so I need to ask you some personal question. I hope you don't mind. Is it okay? The patient will be like happy to answer your question, and so you feel like you are clearing the cloud a little bit. Then you can ask, okay, you mentioned you've been to Thailand. Have you had any sexual intercourse or anything which is protected, unprotected? Those questions, and they may come up with, yes, I had intercourse, sexual intercourse without protection. Then you have to think, oh my God, maybe there is something else going on. Like first thing you'll think AIDS, sexually transmitted disease, all these things. How do you come up with the explanation to the patient? Okay, you have to be non-judgmental to say, okay, because of the history of sexual history, we may have to do some more investigation. So initially, if someone comes with the idea, you may say, okay, we're gonna check your stool, we're gonna do some blood and stuff. But in this case, you have to say, we have to do some special tests, like HIV tests, like sexual transmitted disease infection marker. So in this case, what you need to do, we need to we can refer you, or you can self-refer yourself to GUM clinic, genitourinary medicine, or sometimes with some area they say sexually transmitted disease clinic, STI clinic. So they are well equipped. The reason you have to explain to them, the reason we are referring to them, they are well equipped, they are very specialized in this service, and they know what they're doing. So which is the best solution for you. So patient will be happy to go there. They may ask you some tricky question. Is it AIDS, doctor? What will be your answer? We don't know. We don't know. We have to do the investigation. It's very too early to say anything. We don't know. You have to get the result back. They may ask you a tricky question like, are you going to tell my wife? No, you can't tell his wife without the patient consent, first thing. And second, we need to know what's going on first. We need to get the result first, and then you need to follow up with the patient and then have a discussion with the patient, the way forward. Other thing, you must ask, since he back from holiday, has he had any unprotected intercourse with his wife? If he does, then a different dilemma you are facing. Then the GUM clinic has to contact his wife. His wife also will need investigation to make sure she doesn't have AIDS or sexually transmitted disease. But before that, I think they will do his test, and once it's confirmed, if it's confirmed that he has STIs or HIV, then they may contact his wife. Okay, we say in this case we can contact tracing. But if he doesn't have any unprotected intercourse, or if he didn't have any intercourse, we don't need to do the contact tracing in these cases. I hope I explained the case properly. If you guys have any question, you can answer. Do you have any question you can answer?